A key goal of the STITCH project is the creation of a fully integrated medical instrument plug-and-play environment. The STITCH project is working to define prototype standards and techniques for creating safe systems of interoperable medical devices.
A plug-and-play environment would open up the possibility of everything talking to everything within the surgical environment at the system level, so that you could then have smart programs, smart operations that happen without the need for the surgeon to do everything in his or her head.
As technology projects go, the unique things are the focus on the evaluation of the technology in the hands of experienced practitioners, and the idea of integrating technologies in a way that actually helps the practitioners instead of just adding more devices to their little islands of technology.
The idea of a plug-and-play environment makes each of the systems required to do a surgery aware of each other and defines a protocol for those systems to communicate with each other.
We developed a complete framework for being able to integrate all of the systems in a surgical environment into one common computational setting. That kind of design framework ends up being crucially important if you're going to rely on software that's written over the top of these crucial mission-critical systems. Well, you can imagine a piece of software that might want to take an image on demand, like an X-ray, but there can be no movement, because the movement might cause a blurring or a reduction in the clarity of the image. So if the system that's going to take the image could communicate with the anesthesiologist and the equipment controlling the breathing, it might be possible to hold the breathing for an extra long moment in order to capture the image.
Because of the danger in manipulating surgical equipment as critical as life support systems, surgical teams need to know the framework is monitoring the entire system with the patient's health as paramount.
What we've found is that the framework and the design specifications are critical, and the result we've had is that we've been able to take software engineering tools for designing programs to specifications, and we've been able to modify them so that they work within the healthcare environment.
The things that technology is supposed to help bring is relief from the mundane tasks and an ability to interact on a higher level with the patient. And so that's the kind of thing that we're focused on, is taking the details of the technology out of the practice of medicine and allowing the clinician to focus on the treatment plan.
I think later on what we're going to see are some very, very interesting mid-level programs that the surgeons can run that do very complicated tasks across all the different things that take place in surgery. That can only happen when this environment for designing and coding those programs has been completed.